one of the most disturbing physical symptoms in women with polycystic ovary syndrome. Just after hirsutis, belly fat, alopecia is acne, and I'm sure I don't have to explain you why. Big, painful cysts under the skin, especially on our chin, cheeks, neck, chest, back, and very often all over the face, can have a huge impact on our mental health and our quality of life. Traditional acne treatment like topical retinoids, benzoyl peroxide, and antibiotics might not be as effective in managing acne in PCOS because they do not address the underlying issues and hormonal imbalances. But what to do? Welcome to Holistic Ovaries. I'm Agnes, and every week I post a new video about polycystic ovary syndrome. Subscribe to my channel for more information, for free education, and also if you subscribe, this helps more women with PCOS just like you to reach that knowledge. In this video, we are going to talk about 4 underlying issues for acne in PCOS and what you can do to balance them. And then we will talk about the skin routine. So all inside out approach. Managing adult acne can be challenging because it requires the comprehensive approach that address the underlying issues and the visible symptoms. And treating acne in PCOS can be particularly challenging because we women with PCOS often have higher level of androgens, we are often insulin resistant, we have higher levels of chronic inflammation, oxidative stress, and gut dysbiosis, and all of these factors can contribute to acne. Because acne is multifactorial condition and require approach that focus on all the underlying issues that can cause acne. And today, let's have a look what in PCOS can cause acne. Androgen excess. This one is the most obvious one because 70 to 80% of us women with polycystic ovary syndrome suffer from hyperandrogenism. That is the main reason for acne. You have androgen receptors in your sebum production glands and hair follicles on your skin. The more androgens you have in your body, the more your skin will produce oil, the sebum, and this can cause development of acne. Reducing androgen levels is going to be first step to treat acne in women with PCOS. I prepared a video about that, how to treat androgen levels naturally, and you can watch it here. Inflammation. Chronic inflammation can contribute to development of acne through different mechanisms. Inflammation can compromise the skin barrier functions, leading to water loss and dehydration of the skin. This can disturb the delicate balance of the skin microbiome, leading to environment that is more conducive of the growth of the bacteria acne. Additionally, inflammation can cause the breakdown of the collagen and elastin in the skin, leading to scarring and post-inflammatory hyperpigmentation. And what can you do about it? Eat diet full of food anti-inflammatory like leafy dark greens, spinach, kale, berries like blueberries, strawberries, raspberries, and any other vegetable and fruit that is anti-inflammatory. Use anti-inflammatory herbs and spices like turmeric, garlic, ginger, and green tea. Include foods rich in omega-3 like salmon, chia seeds, flax seeds, or consider supplementing on omega-3 fatty acids. And of course, I wouldn't be myself if I didn't tell you reduce your stress and improve quality of your sleep. And to find more information, I prepare for you the video how to heal inflammation naturally, and you can look at it there. Gut dysbiosis. Gut dysbiosis is the imbalance between many different microorganisms in your gut. Harmful bacteria in your gut can produce toxin which can trigger immune response and trigger inflammation. And systemic inflammation, as you already know, can cause acne. Therefore, it is so important to take care of your gut microbiome by diversifying the different microorganisms which lives there. And you can watch the video that I already prepared for you about that. But to make it short, what you can do is to eat more rich food in fiber, in probiotics like kimchi, kefir, sauerkraut, and if needed, supplement with probiotics. And as with everything, sleep good and reduce stress. Insulin resistance. Insulin resistance can cause the more production of androgens. Furthermore, insulin resistance can cause oxidative stress and inflammation in the body. Insulin resistance can cause changes in the skin cells, and this can contribute to development of acne by changing the normal turnover of skin cells, and that can promote formation of clogged pores. What can you do about this? Your main goal here is going to make your cells again sensitive to insulin and improve your mitochondrial function. And now, this is something that we will have to discuss in another video because it is quite complex topic, and weight loss as often prescribed for us women with PCOS might not be enough. But what you can do for now is, number one, increase your muscle mass by adding more protein to your meals and by resistance and weight exercises. Avoid exposure to environmental toxins like air pollution, cigarette smoke, and pesticides. You can support your body by supplementing with magnesium, vitamin 3, and coenzyme Q10. Okay, now that you know what to do to treat acne from inside, let's talk what you can do to treat your symptoms from outside. Number one, hydrate your skin with very good moisturizer, which is non-comedogenic. I myself made this huge mistake that I was over drying my skin to really get rid of the acne, but this made the producing sebum even more, that makes everything worse. So hydrate. Use gentle cleanser that is pH balancing. I myself use cleaning products that are oil-based. Avoid alcohol-based toners and products with a lot of fragrances. I myself have very, very sensitive skin, and I try to use cosmetics which are natural and with as little list of ingredients as possible. I know that sometimes treating acne we need something more strong, so it's best you talk to your dermatologist. Avoid the scrubs and exfoliants that can damage the already delicate skin barrier and microbiome on your skin. You can consider to use products that have probiotics. Wear a sunscreen. Sun exposure can trigger more inflammation and causing more acne, and also it can cause scarring or hyperpigmentation. So wear the broad spectrum sunscreen, at least 30 SPF, and every day, even if there is no sun or cloudy days, and even if you stay at home. And now the most difficult one, do not touch your skin. Every time you find yourself touching your skin or you have this urge to touch your skin, say to yourself, stop and touch something else. You can place your hands on your heart, take a deep breath in and say to yourself, I am going to be fine. Even if your acne influence your life, your self-esteem, your confidence, and your quality of your life, remind yourself that this is a journey and you are taking a small steps to improve that and improve your life. I believe in you, and you should believe in yourself also. If you have any questions or you need support, you can always leave me a comment here, or you can contact me on my Instagram, which is pcos.ask.agnieszka, or you can also send me an email at Anisa at holisticovaries.com. And thank you for being here, and I will see you in next video. Bye bye.